Hello there, welcome to another edition of Health Matters, a presentation by the Ministry of Health. Glad that you can be with us on our program. And today we've got visiting Guyana, members of the U.S. Southern Command. We've got Dr. Jacob Braun. He's an emergency medicine specialist. He's a captain attached to the U.S. Army. And that's he's in the middle. We've got next to him is Army Staff Sergeant Dreesen Botkin, the scrub nurse. And of course, next to Captain Dr. Jacob Braun, we've got a local surgeon attached to the West Demerara Hospital, Dr. Chiman Ramdari. Gentlemen, welcome to Health Matters. The U.S. Southern Command is not the first time that collaboration between the government of Guyana and the United States, relationships in so many fronts, but this time it's here to strengthen, as it reads here, to strengthen this relationship by addressing transboundary challenges together, sharing knowledge and building trust. I'll start with you, Dr. Braun. Tell us a bit about your work with the U.S. Southern Command.
Yes, sir. So we started in Suriname. Guyana is our second trip, and then we'll end in St. Lucia. So far, it's been a phenomenal experience, particularly here in Guyana. I had the opportunity to work with the Guyanese Emergency Medicine Specialist residency program. They actually offered for me to give a lecture last Tuesday to the residents. I've been mostly in observatory. I helped with some of the patient care in the emergency department, just sharing knowledge with them, what I teach my residents back home because I work with an educational program, just kind of giving my tidbits on different patient presentations and how to help them with different pathologies. It's actually been a really awesome learning experience for me because we've been seeing a fair amount of complicated malaria patients, dengue patients, leptospirosis, which are not common cases that I see in the United States. So I feel like I'm learning a lot more from the Guyanese physicians than necessarily what I'm providing to them. But mostly my expertise is with ultrasound and different patient presentations and the perspective that we do in the United States is compared to here.
And Staff Sergeant Botkin, tell us a bit about your relationship and your work with the U.S. Southern Command.
So my experience here is, for this mission has been I would say an exciting mission because you have the opportunity to just go into different countries, and especially countries like Guyana where in the States we focus mostly on minimal invasive surgery, so small surgeries. We don't do much open cases inside of our bigger hospitals. So coming here to Guyana where everything is open, or you try to do everything, you have limited space to do laparoscopic cases, and the majority of it is open cases. So you're getting that experience to see the anatomy up front has been very eye-opening. The only time that we ever see anything close to that would be during a trauma surgery, which that's a whole lot. It's a whole different field from what we're doing now. This is everyday living. So it's been a good learning experience. And then the sterile aspect of seeing how the commonality between how we do sterility in the States versus sterility here, it mirrors itself. So
let me come back to Dr. Braun, and I'll soon come to Dr. Ramdari. Dr. Braun, you mentioned about cases that you don't normally see in your work. You're talking about malaria and leptospirosis and so forth. Tell us a bit about that and how you were able to draw and what else you can advise Guyanese out there.
Yes, sir. So it's definitely been a very eye-opening experience. We rarely see it. Malaria does not really exist in the United States. We see imported cases. As a military physician, our soldiers are deployed throughout the world, and so we have soldiers that will come back from Thailand or the Middle East, and so I'll take care of cases of malaria, but not to the extent that you see in the emergency department here. And especially patients that are coming in from the interior that may have had malaria for long periods of time, seeing that the complications so that's been a very eye-opening experience for me. So seeing the expertise of the Guyanese emergency specialists and how they approach those problems is something I'll take practice back home with myself.
Mm-hmm. And your experience with those three cases, malaria, leptospirosis, and so forth, how was that new to you, impacting?
Well, with the shared knowledge from Dr. Braun, for us, yes. I don't have as much experience with dealing with it as far as a pathological standpoint. I deal more with it. Well, actually, I really don't deal with it at all, to be honest with you. When we come down to surgery is, you're inside the abdomen. So.
And of course, it's come back to the statement I read here when it speaks about addressing transboundary challenges together, sharing knowledge and building trust. So indeed, you guys are having knowledge sharing moments.
Oh yeah, absolutely. We obviously those cases are examples, but like I said, I was able to give a lecture on Tuesday to their residents about mass casualty triage. It's something that we specialize as emergency specialists in deployed settings, which would be more combat related. So I was just able to provide some of my tidbits of my experiences of being in the United States Army and talk to them, because I do understand that is a common issue that GPHC experiences just with different traffic accidents. And so I was able to provide some of that information from my experiences to them.
Right. What we'll do now, we'll take a break and we'll hear from some of the beneficiaries who were able to be treated by this collaboration between the U.S. government and the Ministry of Health in their visit by the Southern Command.
And what surgery you had?
Hernia,
How did you know you had hernia? What lead you to this process?
belly pains, and then I went to the hospital and they sent me to do an ultrasound. So that is how I get away that I have hernia.
And what was the process like having the surgery done, coming in? What was the process like?
Wasn't bad. The operate good. The doctors that came in was very professional. You understand? They treat you nice, talk to you nice. They run you through the whole surgery. You understand? They was very courteous throughout the surgery.
My name is Alan Stewart. I'm from Osoro, Northwest Dispensary. Come to the hospital here, do a surgery, and everything success. And the doctor do a great job on them things. The only thing I could say, come from far, and I like to be able to keep me there for a little while till I feel good. Then I can discharge. And three, they think can't walk. She didn't think can't walk. I'm the serious cut.
Oh, and what surgery you had?
Oh, yeah, got one.
Our program, we're continuing with Dr. Chiman Ramdari. He's a general surgeon attached to the West Demerara Hospital. The team, they were working so far to two hospitals, the Georgetown Public Hospital and the West Demerara Public Hospital. Dr. Ramdari, tell us what is happening and what will be happening at the West End.
Right, so we are more than privileged to have the visiting medical assistance team on board to help us, share knowledge, share skill set in approaches to surgical cases that we have had. We have started at GPAT on the first leg, completed approximately 45 cases on their own with their own surgeons, and with the collaboration from our local surgeons, we were able to achieve almost 60 cases over the 1 week period. So far, I think we have done 4 cases of the scheduled 50 or 55 cases over the next 5 days. So we are much grateful. The people of Guyana are much grateful. So for the next 4 to 5 days, we'll be operating on simple and complex cases, mostly abdominal pathology such as ventral wall hernias, groin hernias, hydroceles, and hopefully, we are able to create some sort of an impact on the patients who have been waiting for surgery, for a period of time. We have had patients from Region 3 mostly for the first 2 days, patients from Region 4 mostly on the 4th and 5th days. The third day has a mixture of both Region 3, Region 4 patients. So just to have a clearance of a little backlog we have had previously.
As you heard from the two guests, they're having their fair share of learning. You think you and your team will also be having a fair share of learning from them?
Of course. So, different surgeon, different strokes, different techniques. We all share different experiences. Some of the cases that we have been seeing here, they may not be seeing, like, depends on the region or the environment you're in. And of course, with the technology, with the resources that they have, they're able to, share that sort of skill set and knowledge with us. We are grateful for that sort of benefit. Presently, as part of our surgical program, we have 2 residents attached with those 2 surgeons who are visiting operating at present moment. So it's sort of like building rapport with the fellow surgeons, international level, and of course we appreciate such collaboration, that could bring development, progress through education, through training.
Okay, so back to our visitors, Dr. Braun and Staff Surgeon Botkin, Captain Braun also. You're also here. Also, it's your mission is broken down with an Operation Lesser Antilles Medical Assistant Team LAMAT, and interestingly, and of course, Staff Sergeant would have mentioned that work already finished in Suriname, now in Guyana. Then you head off to St. Lucia, and the theme there, the goal is to strengthen partnerships, alleviate pressure on partner nations' healthcare systems, increase readiness and interoperability between medical professionals, and improve the region's public health capacity. Tell us about the LAMAT, Operation Lesser Antilles Assistant Mission. And of course, you guys are well fortified here with your doctors, surgeons, anthologists, clinical nurses, and surgical technicians, and dental and so forth. Tell us, what's the full works available here for Guyana?
Yes, sir. So we have 2 ER specialists with myself. So we're helping out in the emergency department. We have a full Air Force dental team that has 2 dentists, and they're also consistent with multiple techs and hygienists. Correct me if I'm wrong, but I think they've seen over 100 patients here in Guyana already. So they're doing not totally comprehensive dental care, but mostly cleanings, tooth extractions, helping with dental hygiene in general. Then we have our 2 general surgeons, Dr. Hetz and Dr. Bingham, who are helping with the inguinal hernias, complex abdominal wall hernias, as we described previously. And then we have an OR surgical team that consists of nurses and techs that are helping them and helping the support. And I think what's really important too is that we have an Air Force medical mission team here that helps support us through this mission to make sure that we got here safely, that we have the proper equipment that we need, and then a team full of logisticians as well that are making sure that we got the appropriate equipment to do the surgery cases that while we're here, and then also to provide donations to the hospital so that they can further do surgery as well.
And of course, your team has also been looking into some of the areas that you might have a little fault line. And interestingly, the U.S. has donated, I think, in this mission, over under 5,000 pounds of medical and dental supplies to both GPHC and the Zamora Hospital.
Yes.
And that's at a value of $230,000 US. And of course, a portion of this 230 supplies, you have 60 surgical operations and 200 dental patients. And of course, we're talking about biomedical technicians already restored X-ray capabilities at Diamond Hospital. We were talking about this off camera.
Yes.
Maybe we can talk about that now.
So what ended up happening is when we came into country, there was a request, because we brought our own biomedical team to, repair much needed equipment. So the Diamond Hospital reached out and said, hey, is it possible for you to repair our C-arm, our X-ray capabilities? So the X-ray machine was down. So we had the opportunity to go there, and they brought it back up. They also had a portable X-ray machine that was also down. So they went from 0% to 100% by the time we were done.
I want to let's talk about relationship between the U.S. government and the people of Guyana. I mean, basically, it's the people of the United States and the people of Guyana, and both of you are getting the first-hand opportunity to see the work of U.S. government on the ground, the U.S. taxpayers, and you can see time well spent, money well spent. Are you satisfied with what you see based upon your perspective, your government's perspective?
Yeah, absolutely. I mean, I think we had a goal in mind coming here, and so far we've accomplished those goals. And so I'm happy that our government is able to help another country, and that we're helping as a medical team. I feel like we're succeeding at doing that and reaching that goal.
You're no stranger to the region. You have roots here in the Caribbean, Trinidad. Are you satisfied? Now you're in the United States. Are you satisfied with what you're seeing here on the ground?
I am. I am. I think just having the ability to impact the Caribbean, it's a two-way street, right? So we have the ability to impact and learn, but we also have the ability to see the culture. I think that's one thing that we could say about the Caribbean culture and the Caribbean people is that we are rich of culture. We are proud of our culture. So having the chance to show someone else, this is what we do. This is how we take pride in ourselves. I think that's a very important thing.
Dr. Ramdari, it's going to be a lot of work when it comes to dental work. Were you having dental at West or is just surgery?
Right. So the dental has been mainly at the West Denmark Regional Hospital, and now of course is the part of general surgery, operating in the two operating suites. So
tell us a bit about what took place with the dental aspect of it. I mean, when you see a lot of dental stuff here, it means we need to do a little more work with our oral hygiene.
Right. So from the little I've known and from meeting and welcoming these guys, touring them around, we have had a good setup at the dental facility. I'm sure they have enjoyed working with kids, with adults who needed some sort of improvement in dental health. The department of dentistry as well has benefited from a lot of resources like advanced technological materials that they have brought, like one of those rubber bands and those kind of stuff. They have done a fair amount of job because I have seen an influx of patients into the dental department over the previous week.
All right. Dr. Brown, you spoke about, you gave a lecture, and of course, education. This is very much interesting. Maybe you could tell us a bit about that.
Yes, sir. So the topic was on mass casualty triage. Like I said, as an Army emergency specialist in combat deployments, that is frequently what happens when we have U.S. soldiers or partner soldiers, partner country soldiers get wounded in combat, and so we'll have an influx of patients. And basically, it was just outlining that if you have these large events, so say a minibus crashes here on the street, how do you deal with an influx of patients? And used my training from the U.S. Army and then from my residency program during my training for emergency specialist, what ways I would approach it. And hopefully I could pass on that knowledge to them so that if that happens here, they have a good plan in place.
Yes. The staff sergeants were able to impart knowledge also?
Actually, yes. So one of the things that I was able to engage with was the scrub technician training. So here they go through a series of didactic training and then they do on-the-job training, which mirrors what we do in the States. I was able to briefly speak with some of the students, and as we set up the back table or the trolley, how do we set it up so that we know how we can impact the surgery best? Surgical assistant, we really have to be able to do both, focus on the surgery and then still be able to maintain sterility. So just giving those key techniques on, hey, you have to pay attention to the surgery, but you also have to know the surgery. We're not surgeons, but we still have to know the steps to completing the surgery.
This is Health Matters, and we'll hear from more of the beneficiaries of this Southern Command outreach for this year.
The surgery you had today, what was your condition? Hernia? And you were explaining how you found it. You gave us back information.
Find out when I was doing work, I find it, I just see something just swelling all the time and going out flat. So one day just let them tell my sister, so when I come to the hospital and see what's up around with me. So when I went, obviously I got hernia, so I just get it looked after.
Right. How was the process like?
All right, man. Everything all right.
Everything
You
good?
all right and so everything good. I thank the government for everything, do everything, everything all right. And so, keep it just like this all the time.
This is Health Matters. Glad that you can still be with us. Um, we've been talking to Dr. Chiman Ramdari. He's general surgeon attached to the West Demerara Hospital. Of course, the captain attached to the U.S. Army. Dr. Jacob Braun, emergency medicine specialist, and Army Sergeant, Staff Sergeant, Scrub Nurse Dreesen Botkin. The visitors are in Guyana. I'm as part of a Southern Command team that is here to assist and provide so many and necessary work here as it relates to the medical field in Guyana, speaking about relationships between the United States and Guyana and to strengthen it by addressing transboundary challenges together, sharing knowledge, and building trust. Very, very important. Dr. Ramdari, as we wrap up, what does this mean to you as an individual and your team at the West Demerara Hospital?
We are very fortunate. We are very humbled to have this visiting team, coming to provide a service much needed to our region. Our region has had its fair amount of challenges, but we have been developing, and we see this as an opportunity to even progress with our development. We're able to provide a standardized care for patients needing surgical assistance, and we are grateful for the opportunity of rapidly performing surgeries over a short period of time for a number of patients. And I think this more or less has given us a break from, having patients waiting long times for surgery. So, with the experience that they bring, the resources, the supplies that they bring, we are happy to complete almost, if we put it, GPHC and West Demerara Regional Hospital, it's, 130 surgeries over a 2-week period. And, that's a significant number to talk about.
Staff Sergeant Scrub Nurse Botkin, tell us a bit as we wrap up your overall experience.
My overall experience is that I'm completely impressed. The amount of organization that it takes to make a hospital run, far less a surgical suite, it requires down to the minor details. This Saturday alone, we went through upwards of 22 cases in one day. And that for me is a week's worth, normally in the States, a week's worth of surgical cases, but just they were able to do it. We were able to complete all of those cases in one day. That's impressive by any standard. And we did it with the care. We did it with aseptic technique, and we did it, with the intent to help.
And strange territory too, right?
Yes.
Yes. Doctor.
Yeah, it's been a wonderful experience here. Like I said, I've learned a lot from the Guyanese physicians. First, I just want to thank the country of Guyana for having me here and allowing me the opportunity to maybe share some knowledge to their physicians and other medical providers, and allowing me to treat the population here. The culture is phenomenal, and the people are wonderful here. And I hope at some point I could come back and do this again.
Please do. Gentlemen, doctors, and staff surgeon, please, thank you very much for your visit and our visit to our studios here at Health Matters. Thanks for being with us on our program. I would just like to remind you that we're still in a pandemic, COVID-19, and we would just like you to take all precautions. Still, you need, for those of you who have not taken your boosters, it is very imperative that you should really take your booster vaccines, first dose, second dose. People are still dying from COVID-19. People are still being infected and are being sick because of COVID. So we implore you, please visit your nearest treatment site or your nearest health center to find out how you can get your first booster or second booster. Or if you've never taken a vaccine, a COVID-19 vaccine, please we're begging you to, for the safety of all, take your vaccines. I'm Nazim Hussein. Glad that you can be with us on this edition of Health Matters. See you again next time. Until that time, stay safe.